All right, welcome everyone back. We had our 10 minutes break. Just want to give you a quick introduction to the course and download this document so you know where it's located. So under the first video of each module, it is where the document's located. So here we have module 2. You press that, you download that document, right? Once you download the document, you should be able to, ideally, you should be able to save it, print it, right? This document. And as you went through module 2 with us yesterday, you should be going through this document in detail. So this is advanced practice skills. As I mentioned, this is where most of the questions will come from, the majority, right? So yesterday we cover the MMSE versus MMSE, right? So highlight few things. Thought process. Think of it as organized thoughts and ideas, right? And when you think of thought process, tangiality and circumstantiality, we talked about thought content, right? Suicidal ideations, where you document thought content. Homicidal ideation, where you document thought content, right? So if the answer is MSE, that would be also correct. But if you don't know the difference so well that the question can be tricky and you get it wrong between thought process and thought content, I highly encourage you to do it before your test date, okay? Yesterday, we also talked about the MMSE, which is different than MSE. MMSE is for cognitive status, usually for those with Alzheimer's, dementia, right? We mentioned that higher number is good, lower number is bad.
Dr. Lopez,
Go ahead, please.
can you go up your slide for 1 second under the thought content? I have a quick question there. So
Sure.
now, under that, it says overvalued ideas or preoccupation, intense fixation. Is this supposed to be under thought content, or like the obsession and compulsions? Is this a thought content?
Yeah, it's more of a thought content because it's not how your thoughts are organized, but it is this obsession, just like persistent thought in your head. It's not an organization of your thoughts, right? So when we think the thought process, think of how your thoughts are organized and the ideas put together. Like, are they word salad? Are they tangiality and circumstantiality? Do you see the difference? With obsessions and compulsions, is like, I have to wash my hands, I have to wash my hands, I have to wash my hands. Otherwise, I'm going to have microbes in my hand. So it's much like delusions and hallucination. But I can see where you're coming from with that as well.
Because
yes.
it's intense fixation on specific concepts. I don't know if it's the wording that is throwing me off.
Yeah, it might be the warnings, but is the patient thoughts, the persistent thoughts, and the ideas that, I have to wash my hands, the intrusive thoughts, otherwise I may have microbe. So when you say thought process, is how the ideas are organized, right? Is this circumstantial? Is this tangiality? Is this word solid kind of difference? I know it's close terminology, right? Right, but that's aligns more with the thought content versus thought process.
Thank you.
Okay? Unless if somebody has a different way of explaining it, I think that's my best shot at it.
Because they just keep thinking about it.
Yeah. So it's not how they thinking. They keep thinking about
Thinking
it.
about it.
Yeah, I'm thinking about it. So that's the way I I like to think, what are you thinking of? I'm thinking about the microbes or, washing my hands, those persistent thoughts. I'm thinking about suicidality. I'm thinking about homicidality. So that's the simplest way I always remember. And I try to distinguish between them. What you're thinking about, is the thought content, and how are those thoughts put together is the thought process.
With
I can say
OCD,
like, yeah, I can
with
say like, for
OCD, they have to
example,
keep going back and forth. They keep thinking about washing and keep thinking about the door if the door is closed. So they keep thinking. So
Right.
that's, yeah.
so
Okay.
for example, we can take it out of there. Just say, okay, what is occupying my mind? I want to eat rice. Okay, I'm hungry.
Okay.
I want to eat rice. That is the thought content. The thought process is, okay, how am I going to come about the rice? I have to put water. I have to wash it. I have to clean it. I have to cook it.
True.
Like that is a process.
Okay.
I don't know if I'm making sense.
I like it. I like it because that's a
Yeah, it makes a
process.
lot of sense.
Yeah, the
Yeah,
process
that's the
of getting
process.
to that rice. But my content is I want to eat rice. But how do you
Yeah.
get to the rice? Yeah.
Yeah, I
I
like
don't know
the
if
way
that
you put it
helps.
too. Yeah, that makes sense to me. But making sense, it's sometimes something so clear to me that I think will be clear to you. And if it doesn't rhyme, if it doesn't stick, find a different way, right? It's not always my way or the only way. You gotta. I like how you put it, the rice. It's if it works, it works. So moving on, because we're not going to give a class, but yesterday, MMSE, also known as Foston test, we want to really cue in a few things. Recall, right, is when you show three things and you say, after 5 minutes, I will ask you again. Are you able to recall the information? And where people get in trouble is with registration. I'm going to show you three things. Are you able to tell me what they are in less than a minute? Do not get those confused. Another one is attention, concentration, calculation. Spell the spell word backwards, right? Or a series of 7. We also talked about the mini cog and the MMSE as a way to do the clock drawing test, right? So drawing is part of your Pareto, right? So here I have language, reading and writing and drawing, right? No surprise, the Pareto and this test assess 4 dimension, right? So when you are able to draw, read, or write is your Pareto brain. Okay, then we moved on to therapeutic relations. We talked about the patient needs and goals, right? Focus on the patient identifying needs. And we talked about that has to be acceptance, non-judgmental, authenticity, empathy, respect. And we talked about the transfer, counter transfer, right? Someone gave me an example a few weeks back. They said, hey, imagine a nurse encounter. If you are given to the patient, it's counter transfer. If the patient is given to you, is the transfer.
Sure.
Meaning that if your feelings is towards the patient, that's a counter transfer. If the patient's feelings towards you, that is a transfer, right? Simple concept, but if you really don't fully understand, you may get this easy question wrong. Then we talked about the suicidal risk factors. We went over them. And most importantly, we said that which psychiatric condition is known to have the highest suicidal rates would be?
Schizophrenia.
Okay. And then we talked about race and things like that. And we mentioned about Native American.
Native American.
Okay. And we talked about to carefully assessing A, B, C, and D, and counting each one of those factors. Do not fall for previous suicide attempt. as the right answer, because if one A has previous suicide attempt, B has major depressive disorder, lost a job, single, 45 years old, white male, that will be the stronger answer. 5 factors compared to 1 strong factor. But if we were comparing only 1 factor, then would be previous suicide attempt. Okay? We talked about SIWA. Again, 8 plus, PRN only, hits 15, PRN plus schedule. Ativan or lorazepam. Alcohol minutes, then disulfiram, acamprosate, and naltrexone. So I encourage you to, once you go through this, you should be going, okay, like this, like Rebecca did today. Let me see. I said, tell me about SIWA. Where's SIWA? Okay, you should go to this topic and put your finger on it and say all things you remember about SIWA, medications, without looking at it, right? Because that's the act of recall, what is more important than passively watching our videos or reading it. If you are able to say SIWA, okay, the numbers, the medications, when do you use it, how many components of SIWA. Since we talked about that, remember, if they are asking you to give you a number, you don't have to know all the 10 components of that, of the blocks for SIWA. If it says extreme or intensive or severe, you assigned a 7 to it. If it says modern, then you assign a 4 to it and you calculate the numbers, okay? Someone has a hot mic there, just in case, if you don't know, okay? So please practice that. And if you don't know what I'm talking about, ask. So we went over alcohol, when is most dangerous. Okay, we talked about the sulfurin, right? 12 hours before the last drink, 22 weeks after the last drink. Very important. Nothing can be used with alcohol, right? Oh, sorry. Okay. Can you guys still see my screen or no? Yes. Okay. All right. Then we went on and talked about opioids, right? So 5 points on the cows, you give clonidine, 13 and up, Suboxone, and buprenorphine, right? What else? We talked about the symptoms, you know, yawning, irritability, pupillary dilation. It is withdrawal. Okay. And we talked about piloerection, which is goose pump. We talked about the scales, how to memorize the scales. You know, we mentioned that, hey, for scales that are assessing cognition, right? Over time, the SLAM and the MMSC both assess cognition, especially for dementia patient, and high score is good. And we talked about back, PHQ-9, HMD. If you notice PHQ-9 and add, they both are 10 to 14, so that's easy to remember. If you add 4 to the 10 to the 14, you have HMD, which is 14 to 18. If you add 4 more, you have HMA, which is 18 to 22, but we call it 4, so to keep in line with the train of thought. And we said 1929 was my grandma, the year my grandma was born. And that way you have your scales. We talked about cows again, right? And we talked about SIWA again. Okay, audit determines that appropriate intervention per seabird protocol. You know, if you identifying what's the next step, right? Let's talk about dust that can be used for drug abuse screening options. All right. Neurocognitive disorder. Be careful with the terminology, right? Between delirium, dementia, and pseudo dementia. I was reviewing someone's test yesterday, and she said, well, when there's depression, I know people say, I don't know, but pseudo dementia is not depression. So be careful with that because it's mean the same thing. The terminology is not exactly the same, but it can be used interchangeably. Okay, so delirium is fast and it has a high mortality rate. Dementia, it takes a long time. How do you separate dementia from pseudo dementia? Is that dementia patients will confabulate to make up stuff, while pseudo dementia would not try. They'll say, I don't know, I don't care, I don't know the answer. Okay. What else we talked about yesterday? That's a little bit of the difference there. We talked about also types of dementia, cortical and subcortical, right? When we say cortical, we think of language and memory. Can also be said as aphasia or amnesia, right? Language and memory. And then we went on to talk about subcortical. We mentioned motor symptoms and depression symptoms, right? And we give 3 examples of each. This is not a review from yesterday's class, but I just want to kind of go over real quick to see if you have any questions from yesterday. So this is not, it's one of the shortest module, but I think it really hits home with of a high yield component. So if you haven't been able to go through it in detail, you should really know this in detail because it will likely be on your test heavily, right? Because it's in a blueprint. It says there will be. It's the heaviest model. We also show you how to find answers, right? So do you see where I went over here to this little answer boat? So the program records me and records all my PDF and find you an answer from my PDF or anything that I ask. If I say, please tell me more about motivation therapy, and it should give you an answer. If I mention anything about MI, it says motivation therapy is also known as motivational therapy, is a non-confrontational approach. I say this all the time, right? To a therapy that aims to elicit change when the patient is ready to change. It involves using a patient-centered technique. This is like from my mouth. Open-ended question, affirmation, ORs, right? The acronym that I use, ORs, so that's where it's coming from. Open-ended question, affirmation, summarizing, empowering the patient to help them navigate conversations about health and well-being. So tell me about trans-theoretical changes. I don't know, didn't even spell right. Oh, no, that did not, sure did not. All right, sorry, I can't understand because it's not right. So tell me about stages of change. Just of a kind of like odd questions without calling trans theoretical model of a change, right? So it tells me about the 5 stages: the pre-contemplation, contemplation, preparation, action, and maintenance. This is not ChatGPT or anything like that. This is me, right? So this is like having me next to you the entire time, okay? So it's not going to give you an answer that's out there. It's going to give you a high yield answer from the course. So I highly encourage you to use it all the time. Now, not everything that I say 100% of the time, sometimes it just spits out of my mouth. It can be 100% accurate. So if you feel that something's not right, shoot me a message so I can fix the boat and also clarify anything that may be misunderstood. Okay, Jennifer, you have a question there?
Yes. In terms of subcortical and then the cortical dementia, I'm trying to find out what does the vascular dementia fall under? Does it?
Neither.
Okay.
Yeah. So neither that, neither Lewy body, not Lewis, right? Lewy body is distinct. You know, it's kind of like in between, not really one or the other. Okay.
And then my last question, and this is so confusing. I've been seeing two different answers. The
Okay.
neurotransmitter for nightmares, is it serotonin or is it norepinephrine?
Yeah. So it's confusing because it is a confusing answer, right? So the reality is the true answer is neither one of them precisely, but it's a combination of both of them, right? If you think about serotonin, it has a lot to do with sleep, you know, and putting you to sleep. That comes from your pineal gland on your brain, right? And that is most likely the answer. I know that a lot of people will be saying, oh, you know, because the fight or flight. And yeah, sure, it is part of nightmare too. But if it's in a test, I would pick serotonin over, okay? Because it has a lot to do with dreams as well. I know it's a bit complex, and we could kind of like go back and forth and break this down uh, in details, but it's more towards serotonin. But in reality, it's both of them. Okay, so pick serotonin.
Thank you.
All right. Any other questions from yesterday or from any other topic? All right, then if it's not, I don't want to take much of your time. I just want to show you these things. So another thing that I want to show you is that we got lots of the same questions in a different format, right? So people asking me, hey, where is the crash course review? Well, that's module 6. Um, that's module 6. And where do I find the 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 PDF? In the same location where all the other PDFs are located, under the first video of the module 6, which is our crash course review, right? So let me open there and show you guys, because I know it can be confusing and I keep adding stuff to the program and may not be super helpful sometimes because it's more stuff, but I just can't help it. All right, so can you guys see it here? The crash course review, like this, everything you need to know to pass. Is it really everything you know, but it's everything that we did on the crash course review in a different format, right? So if I download this, then I would have what we covered the last crash course review in a different format that I'll show you. And it is right there available to you in a concise question format. And I really want to get to finish the rest of them. It's tons of work and I'm working through them. Been a bit behind, I know, but it's coming along here. 1 second, let me open this document for you. Here we go. So now just want to show you this and then we'll kind of finish today's encounter, unless if there is more pending questions or concerns. Okay, can't find it. Anyways, 1 second here. Here we go, found it. All right, so if you open the document, which is under module 6, where all the documents live for each module, right? You see that I did this crash course review in a different format. Is anything new? No, it's not. It's just a different format. Well, I hate to give you the answer because I feel that when I give you the answer, I'm not helping you, right? But do yourself a favor. Just say, hey, define cultural syndrome in your words. Define it. I give you the answer, but try not to look at the answer until you answer yourself, right? At minimum. For modules 1, 2, 3, 4, and 5, I'm not going to give you the answer because I really want you to look for it. That helps you, right? So the idea is that pulling from the videos, and this side you have your question bank. But what's in the middle is how you are able to pull this information. And this is the idea behind this, that you are able to pull it, because having the information not able to pull it is not very helpful, right? But if you look at this, it's maybe like 300 questions, maybe 400 questions. I don't even know. It's a lot, right? It's just a lot of things going on here. Just look through it, especially if you're testing soon, or if you are new to our program and you're just like, oh my God, I'm going to test next week. I would highly, highly, highly advise you to take the diagnosis test 1 and 2 and the crash course review at minimum, right? Should you do the whole work? Yes, you should. It's your life. It's the most important test of your life, right? So you really should put as much as you can. I couldn't, if I were in your place, I would, it is the stepstone for your best life, right? So it should be no price or anything in between you and your happiness and your next degree and your goals. I mean, it is the most important test. I can't put it any other way, right? So put your effort, the best effort into it, like you really mean it, like you are unstoppable, okay? Pass, I think you have a question there.
Yes, how do I go up and sign so I could join your review?
Oh, okay. Yes, let me put the link here. You can go to www.npexamcoach.com. But instead of doing that, since you joined today, let me put this link, and then you can click right on it if you feel like this is something that you want to join. You can do so. Okay. Are you able to see the chat box here?
No. I'm
No.
on
Yes, you want to do chat box. Chat box is where we all talk to each other and support each other.
Do you see it?
I saw the link.
Okay, so click on the link. It'll give you a special discount there. And then
I'm sorry,
welcome.
WhatsApp. Sorry, I got out of order.
Okay, thank you.
Dr.
Yeah.
Thales, well, can you
Yes.
send me the link as well? This is Lucretia. I'm actually driving, so I want to know, I want to be able to join tonight.
Yes, absolutely. Could you? I need your email in order to send you a link.
Okay. Well, I'll tell you what, I'll send it to you in a messenger. I'll
Perfect.
send you my email address, and then you can just send me the link and I'll just sign up. And thank you
Okay.
so much for everything. It's just been very informative.
Okay, I'm glad that you guys found it helpful. We'll give everything that there is to give. I can promise you that. We'll try as much as possible. We'll find ways to help you and support you. And it's for 6 months, so that means you shouldn't rush. You can't attend as many classes as you like. There is no restriction. It's all in, because I think it's the most important test of your life. So it should be no restriction, at least in my mind. So it's all in. Let's do it. Let's get through this hump to your own next stage of your professional development, right? Thank you for wanting to join. I appreciate that. I think it's going to be a good investment. So,
And thank you for
all right.
reaching out immediately, because I appreciate that as well.
Mm-hmm. Oh yeah, so that's a good disclaimer, right? So that's probably more of a lucky thing than a true thing, because I can only reach out to people on emails. Sometimes I'm able to do social media, but 20 different social medias, and I have 20 different inbox. So email me, you always get an answer within reasonable time frame. Social media, sometimes, I don't want to take the credit to say, yeah, I reach out immediately, because that's not always possible. But thank you. But I know where you are, and I'll follow up with you for sure.
Sounds
Okay.
great.
PsychNP there, you have a question? You had your hand raised.
I just wanted to ask, how is your eye?
Oh yeah, it's getting better. Last week I flew to Hawaii to have a specialized appointment. So I'm going back to the US in a month for good. So they kind of curtailing my assignment here. I'm going to Kansas, and then I'll have 2 more surgeries. So that was the decision to kind of navigate through this issue. So for those that don't know, I had a retina detachment. I kind of lost vision on my right eye recently, but God is good, and I mean, I guess maybe a defense mechanism. I didn't care much for it, but I really think one thing of life. If there's anything that you
Sorry
can
about
do
that.
about it, I tell my patients this every single time, in every single section, the simplest way possible. If there is anything bothering you, or anything you can do about any situation, do it. Because if you don't, that's gonna bother you.
Mhm.
But if you can't, if you've done all you can, then don't worry about it.
Mhm.
Because worrying is not gonna help you, right?
Yeah.
So
That's
that
true.
applies to tests. I do all my best to score A's and to be on top of things. But once I've done that, I'm singing of happiness when I go take a test. I'm just like, woohoo! It's like I'm drugged up because I know I have done my best, and the outcome is not up to me if I done my best. But if I walk into a test and I know that I have not done my best, then I'll be biting my nails, because I know I failed myself. So, and that's pretty much how I live my life. If I know that I've done everything that possibly can, then I live in no regrets, zero regrets. So it happens, it happens. What can I do about it? Well, go find out why and go get a treatment, right? I mean, worrying about it is not going to do me a whole lot.
Did
Sure,
they perform surgery already when you went
yeah,
to
so
Hawaii?
yeah, I had 2 surgeries. Then they say they're gonna try a more specialized treatment. No, but I'm seeing good. It's just my problem right now is because once they also did cataracts, so they put a lens behind my eyes. So now I'm having this disturbance in vision, which is called micropecia or micropecia. So one eye I see a regular size head, the other one is super small. So it's a
Oh my
bit
gosh.
disturbing. Yeah, it's super disturbing, especially reading. I can't really see the screen very much right now, unless if I close one eye, I can see it, right? So
Well, you're not
working,
wearing your glasses. So I
Glasses,
thought you
right.
were.
I was just about to say.
yeah, it doesn't help, right? Because my glasses was before the incident. So now my glasses, it makes it even worse.
Oh
So
my
like
gosh.
I'm typing and working, and I still have a full load of patients. I'm like trying to catch up with things, and it's been hell. But all in all, super thankful, super grateful. Not really a thing to worry about it. I think it's moving along.
You
It's
touched God.
yeah, it is what it is, and I'm not downplaying it. It's a very serious condition, but I'm happy, just happy. So
Yeah. Well, I'm happy to hear
Um,
that. I've been meaning to ask you every time you're on, and I just don't want to interrupt, but I
yeah,
just
no,
wanted to
thank you.
follow up on that.
Appreciate it. It's recovering, and once I get you back to the US, I'll have another surgery, and then it'll be okay. It'll be
Oh,
fine. So hopefully it'll be fine, right? So crossing my fingers. But thank you for asking. I appreciate it. So
cool.
guys, I want to be always respectful of your time, right? Uh, when you don't understand something, email me, right? So my duty to you is to provide you the time and understand that if I didn't say something that didn't really stick with you, it's my job to find a way, right? So email me and I'll put it in a different way. It may be a second email or third email, but I'll find a way to stick. Never go to sleep thinking, oh my God, I don't know about this, or didn't quite understand what he said, right? Don't let that nag you. So if you did understand, I put it the best way I possibly can. But if you did understand, then ask, and then I'll get back to you. Everybody should know my email is a PMHNP at npexamcoach.com, PMHNP at npexamcoach.com. And, study hard because your best life is so close, right? We don't want nothing to be in between your move in life.
Dr. Lopes,
Yeah, go ahead, Rebecca first, and then I'll go to other.
I'm taking the board exam Wednesday.
Yeah, I know that. You passed already. I told you.
Passed already, okay.
Yeah, I already told you this. Didn't I tell you in the email? So don't worry about it. You already passed. It's
Yes, you
it's just
did.
gonna be
I'm
a
very
regular
excited
day.
about it.
I didn't want to tell anybody, right? But I know that you're testing, and I know that you already passed, and I already told you this. So
I
I'm
can't
not
remember
concerned.
the test in my life I was excited about. This is
Yeah.
yeah.
And that is the aim, right? You should be happy, like, oh yeah, I want to test, like, because you're not fearful, right? You already passed, Rebecca, so
Yeah.
you have nothing to worry about, absolutely nothing. So
Yeah. Thank you. Thank you for everything so much.
yeah, great. I'm glad that could be helpful, for sure. CRS Inc.
Yeah,
Okay.
Dr. Lopez, I want to remind you to add me to WhatsApp group again, please.
Yes, I sure will. I gotta open my phone and get that done. As soon as the meeting is done, I will text back everyone that texts me. Immediately after this meeting is my first priority. But thank you, appreciate
Please.
that for sure.
Thank you.
There was another question, right? No? Okay, guys. Have a blessed night. It was always great seeing you guys. Email me one more time, right? So I'm here for you. Tell me what you need. You never bother me. Never, never, never. Okay, so don't feel, oh, I just emailed you 3 times and you never bother me. So if you emailing me again, it's because you need something. So we are on it. Okay. Other than that, you guys have a great night, and I'll see you guys
Thank
next
you.
week.
Thank
Live
you.
class. Yeah.
Thank
So
you.
if you're
Good
new-
night.
if
Thank
you're
you,
new-
Dr. Lopez.
yes,
Thank you
and
so much.
absolutely. So next week, module 3,
Module
right,
3.
5
Yeah.
p.m. Eastern
Okay.
Standard Time.
Okay.
Module 3, and then we meet up again on Saturday, and we do that every week. Okay.
All right.
All right, guys.
Thank
See
you.
ya.
Thank
Good
you.
night, everyone.
Thank you. Bye-bye.
Thank you.
Thank you.
Good night.
Good night.